Hello, good afternoon and welcome to News Today. In our headlines, Ghana bleeds 10 million cedis each year to medical negligence. Health Minister warns of a, quote, monster rearing its head, end quote, as WHO boss sounds alarm on shrinking global health aid of about 40%.
We spend not less than, even in some cases, one facility, not less than 10 million Ghana cedis on medical negligence. Maybe you don't know.
Also, breast cancer claims the lives of 2,000 women in Ghana each year. Stakeholders are calling for urgent action to close gaps in diagnosis and treatment.
Physical or geographic accessibility. Our health facilities are not equally distributed. They are not equally stocked in terms of infrastructure.
And in the bulletin, Interior Minister and health experts warn of a raging opioid epidemic in Kumasi, a deadly scourge stealing lives and fueling crime.
So what drug is this?
This one is a red.
Red.
225.
225.
Red.
Why?
This one is they call Unu Red.
We'll bring you more in our yet-to-be-aired hotline documentary titled Deadly Doses. For the next 60 minutes, we have these and more, including business, sports, and world news. Joy News, independent, fearless, and credible. Please stay for details. Thank you for choosing us this afternoon. First, 10 million Ghana cedis. That is a staggering annual cost Ghana pays for medical negligence. Health Minister Kwabena Mintah Kando has warned that the crisis is no longer a silent problem, but a, quote, monster rearing its head, unquote. He insisted the government will confront the menace head-on before it further erodes trust in the country's health system.
Medical negligence. Anytime I hear that, I clench. We spend not less than, even in some cases, one facility, not less than 10 million Ghana cedis on medical negligence. Maybe you don't know. As a country, we don't have the money to buy the equipment, but we are spending so much. As I speak to you now, the cases on my table within this week are 3 that Attorney General has written to me to provide responses. Medical negligence. So it's a major issue that we are dealing with.
Now, concerns like these bring to the fore issues of healthcare financing, especially with global aid cuts. In fact, head of the World Health Organization, Dr. Tedros Ghebreyesus, speaking recently in Accra during the African Health Sovereignty Summit, sounded the alarm that Africa is at a risk of a deepening health crisis as global aid shrinks. He disclosed that donor support for health has dropped by 40% and urged African leaders to act now, not with dependency, but with bold domestic solutions. Take a listen and we'll talk.
As you all know, sudden and steep cuts to aid are now causing the most severe disruptions to health systems since the peak of the COVID-19 pandemic. According to WHO's latest analysis, health aid is projected to decline by up to 40% this year compared to just 2 years ago. This is not a gradual shift. It's a cliff edge. Life-saving medicines are sitting in warehouses. Health workers are losing jobs. Clinics are closing, and millions are missing care. We must all adjust to this new reality. But in this crisis lies an opportunity to shake off the yoke of aid dependency and embrace a new era of sovereignty, self-reliance, and solidarity. In 2023, Africa received $74 billion in aid. but lost $90 billion to illicit financial flows and $55 billion to corporate tax exemptions.
Now, should taxes be increased, products like tobacco, alcohol, and sugary drinks would raise $3.7 trillion, could be raised globally in 5 years, while saving millions of lives. What's the cost of healthcare in our economy and across the continent? Isaac Kofi, our lead data research analyst, is here to give us the breakdown. Now, Kofi, let's situate the conversation a lot better. Where does a big chunk of our funding come from, especially in the health sector?
What we know, according to the WHO, is that if you look at Africa, WHO estimates that health investment is expected to drop by some 40%, or has actually dropped by 40%. And it's simply because there are countries that are currently pulling out. They estimate that 2023, they got somewhere around $25 billion in terms of health investment. But this year, their projection shows that this could drop by some $10 billion from 25 billion to $15 billion in just 1 year. Why is this important? Because you have countries that are, currently reducing their investment in healthcare. Number one example is the US, and some European countries also moving elsewhere, looking at other aspects of their budget and not so investing in healthcare. And that's affecting Africa. Why is it important? Because if you look at the data between, since 2006, you see that almost all the time, the grants we get from external aid has always been more than the domestic health spending. And in the case of Ghana, for instance, this year, although health expenditure or health budget is second when you're looking at the ministries, you will see that about 73% of that is expected to be used to pay workers. And you ask yourself, the remaining, 17% or 23%, how do we close, that gap? This is our situation so far. The WHO expect that we should spend about 15% of our revenue or of our budget on health. But as we speak now, we are doing just about 6.5% so far. So you look at the trend. In terms of our healthcare budget so far, this is expected to reach some 17.8 billion. This is a big figure, but MFR, 73% of this health budget will be used to pay workers. So you ask yourself, how do we get money for capital expenditure? How do we get money to buy equipment? And on top of that, we are paying huge sums of money in terms of medical negligence. And the minister spoke about that. Just look at this graph, and you will see that we've actually been dropping in terms of the percentage of our, budget that we spend on health. We went as high as 7.66 in 2019. I was surprised that we even dropped during the COVID period, and now we are plateauing around 6% of our budget on health expenditure. This simply means that we are far away from the target of 15% that WHO gives us. We are not even doing, more than half, right? So we are far below. But there's a solution. The WHO says that although you are struggling, they believe that if you're able to focus on areas like tobacco and also alcohol and sugary drinks, you should be able to increase your revenue that comes to the health by some 50%. And they have given the global perspective. Ghana is included. It will be interesting to see if we are going to look at this direction. Already, we know that the NHIL has a levy, and over the years, we've all seen how that fund has been used. This year, it has been on, it has been uncapped. Let's see if that can help close the gap. But the big issue is that health budget in Africa has dropped by some 40%, and it's simply because our external donors are not bringing in money like they used to.
Thank you so much, Kofi. Beyond that as well, we know that Olusegun Obasanjo has also proposed that there should be some levy on flights coming in and out. And if we add all of that, I'm certain that will be added to the solution. Thank you, Kofi. But Professor Gordon Abeka Nkrumah is with the Department of Public Administration and Health Services Management at the University of Ghana Business School, and he joins us via phone for more on this. Prof, thank you for joining us. Now, first, let's understand how Ghana is said to be losing about 10 million cedis annually to medical negligence from health service management's perspective. What are the loopholes? What are the weaknesses that have been fueling this problem?
Thank you very much, and good afternoon to you, and good afternoon to your listeners. Well, I think that the issue of legal suits normally comes from medical malpractice, negligence, and things like that. These things may happen because of the nature of protocols that medical institutions are using, and sometimes the capacity to supervise people who are working and ensuring that people do what they should do. We all do that within our public system. Monitoring evaluation systems are weak. Supervision is also weak. Again, the fact that within the health system, staff levels are low means that sometimes people do more than they expected to do, and so people may keep their eye off the ball. This is not in any way to exonerate people who do not do the things that they are supposed to do. But
Right.
I would imagine that there will be a multiplicity of factors that are responsible for issues around negligence and malpractice. Some of them, they are basically negligent. Some, too, I would argue that it's an overstretch of resources. But whichever way we look at it, these days, these incidents are on the rise.
Right.
There are argue that they may not necessarily be on the rise. It may well be that they existed all this while, except that now consumers have become legally more aware and they are taking facilities to task. And so that's what it may be.
Well, Prof, a little later in the bulletin, we shall be telling our audience how women, at about 2,000 women lose their lives to breast cancer particularly. Now, let's understand how financing and resource allocation challenges may have contributed to such a situation in this country.
Well, I think that I don't know the reason why you mentioned just the issue of breast cancer, but the point is that financing challenge is not restricted to breast cancer alone. It's restricted to hypertension, almost everything. So maybe the question should be why we have challenges with respect to financing in the health sector. The simple answer is that as a country, we are probably not generating enough. And so what is supposed to go to the health sector is not going there. The Abuja Declaration, we should be doing a minimum of 15% of government budget to health. But that is not happening at the moment. And so it tells us of the general challenges that we have in terms of financing to the health sector. The situation is further exacerbated by what we call the donor transition. We have a lot of donors that are transitioning out of support to the health sector because we are now a middle-income country, and so they have to focus their attention on countries that are low income and need more help than Ghana, that is supposedly a middle-income country.
Right.
In addition to that is the recent withdrawal of USAID, okay, which also provides funding for several other agencies that provide resources. We know that the USAID withdrawal alone is taking something around $156 million from the funding budget in health in Ghana. And so all these are collectively responsible for the shortfall.
Well, Prof, finally, there have been some suggestions from the WHO itself. It says that if we raise revenue through taxes on tobacco, alcohol, sugar drinks, and even levies on international flights, do you see these as viable and sustainable solutions for Ghana's health care financing?
Well, thank you very much. I mean, there are people who have said these things, but we need to understand that these things cannot be done in isolation. So, for instance, if you say that we should put extra taxes on flights, we already know that in Ghana, our airport taxes are about one of the highest in the sub-region. So if you are going to put extra taxes, maybe what will happen is that the airlines may decide not to come to Ghana because we're just too expensive, and they may operate elsewhere, and that will be to our loss. You talk about the fact that we may need to put taxes on sugar, but sugar is a common commodity within Ghana. And so if you put taxes on sugar, you're going to hit the pocket of households. I am not saying that there are not areas that we should go to. But if you go to those areas, remember that already these items are having 15% VAT, and then you have 1% NHIL, you have 1% guest fund, you have 1% COVID. Is it 1%? No, I think 1 point something percent. So if you decided to do that, then you are going to increase prices that may end up having impact on inflation, and I'm not too sure the Minister of Finance will want to do that.
Well, the WHO suggests that on products such as tobacco, sugary products, which they believe are not very good for our consumption or healthy for us, on products such as that, do you support it?
If you say tobacco, yes. But if you put it on sugar, sugar is consumed in every household, unless you are talking about sugary beverages. But if you talk about sugar, sugar is used in your bread, sugar is used in your cocoa, sugar is used in. So what you're going to do is hit the pockets of the average Ghanaian household. And I am not too sure the Minister of Finance will be happy with those sort of things. But let me say that, yes, we have a hole that we have to fill. And so, of course, increasing domestic resource mobilization through tobacco, alcohol, I think that those things.
Right. Thank you so much, Prof, for joining us on the news today. Now, still on health, 2,000 women die in Ghana annually of breast cancer. The majority of these women are in underserved communities where access to screening and treatment is limited. That's according to the Breast Society of Ghana. Stakeholders at the 6th Annual General and Scientific Meeting are therefore calling for urgent action to bridge gaps in diagnosis, treatment and patient support, particularly in some regional hospitals across the country. Elsie Texan reports. Read to you.
From inadequate mammogram services in Tamale to unaffordable radiotherapy in Accra, breast cancer patients face vast challenges. The Breast Society of Ghana, however, is pushing for swift action in diagnosis and treatment. Speaking at the 6th Annual General and Scientific Meeting, President of the Society, Dr. Josephine Nsafo, highlighted the major gaps in access and affordability of care for breast cancer patients in regional hospitals across Ghana. These challenges, she says, have accounted for some of the 2,000 breast cancer-related deaths annually.
About almost 2,000 people died from breast cancer, which is a bit too much. About 70% of cases in Ghana are advanced breast cancer, stage 3 and stage 4. And perhaps they maybe do not get the best as in early disease for a number of reasons. You know, even physical or geographic accessibility. Our health facilities are not equally distributed. They are not equally stocked in terms of infrastructure to treat breast cancer.
Breast cancer survivor from Tamale, Abudu Atika, shared struggles such as limited radiotherapy facilities alongside accommodation and transportation difficulties as major setbacks in Ghana's fight against the disease.
Northern region, some of the challenges we face through breast cancer journey is that Tamale Teaching Hospital doesn't have a mammogram machine. And so sometimes we have to go outside the hospital to get it, which is a little bit expensive. There's no radiotherapy center in Northern region. Of course, we have one in Konfanochi and then one in Kolebu. But then we have to travel all the way to Konfanochi or Kolebu to have a radiotherapy done. There are no places for us to sleep. Sometimes some sleep outside the hospital premises, which of course it's not good for our mental health.
Part, Deputy Minister for Health Dr. Grace Ayensu Dankwa outlined measures to address the gaps in diagnosis and treatment. She assured that where the National Health Insurance Scheme falls short, the Mahama Cares Initiative will step in to provide financial support for patients who apply.
Still in the news, dangerous substances are robbing thousands of Ghana's youth of their health, education and future, from tramadol and cocaine to marijuana and unregulated concoctions. The drug crisis is destroying lives while fueling crime and mental illness. In the yet-to-be-aired Hotline documentary, Deadly Doses, my colleague Nana Wachi-Adam goes inside Kumasi's most notorious ghettos to expose an epidemic that experts warn could soon overwhelm the nation. Here are excerpts of it.
I want Tinker to be a thing of the past in the next 6 months, and I'll be very, very happy.
Our journey takes us deep into the heart of places tagged as drug hubs, beginning with Thinker Island at the Alaba suburb of Kumasi, where you watch several addicts drift off mid-conversations, their bodies still, their minds hijacked. This hub has, for decades, defied efforts to be eradicated. I have met these 3 addicts, leading me into one of the many ghettos in the island. Here, drug dealers operate with an almost open defiance. Our aim is to engage them, to understand their world, and if possible, to spot the elusive cartel that fuels this relentless trade. I begin with 26-year-old Rich Diddy, not his real name, who is already holding 2 tablets of opioid. This will be his second take for the day. He tells me that he started this in class 6 at age 13 after his friend introduced him to Tinker Island.
This, what drug is this?
This one is a red.
Red.
225.
225.
Red.
Why?
This one is they call Unim Red.
Unim Red. Why do you take red?
Because I used to work. It make me work hard to do something like the thing I cannot do itself. I can do it very hard.
For 13 years now, Rich Diddy has been a consistent abuser of opioids, cocaine, marijuana, among others. He is also into alcoholism. He has been to the hospital and has been told about his poor health condition, but says he is unable to stop taking drugs. Seated next to Rich Diddy is 40-year-old ghetto lord, not his real name, who has been into drugs for 15 years now. Despite being a father of 3, he tells me his wife has rejected him because of his addiction.
Cigarette, like rough man.
I didn't know
Tell me no, I'm but at long last, I'm my say cry there, I'm
Baby who?
Na dey kwedi of anode.
Unim say Baby who na wono.
I say so manya mo bia me ntimi fa for so nyai.
Ntimi njai.
You be boane kakra.
These drugs are deadly and we have to be careful. We have to get a regulation to help us regulate these drugs very, very well. Very, very well. Because there are people on the market who are selling it without any knowledge of the opioid. We call them opioid naive people. And these people may take this opioid without any knowledge.
The full story airs on Monday, 25th day of August, 8:30 a.m. and 8:30 p.m. Now, in a related story, the Narcotics Control Commission, NARCOC's renewed crackdown on the drug trade appears to be gaining momentum. This afternoon, the Commission is destroying yet another massive haul seized over just the last 2 months. That's unusually short-term frame, as such large quantities are typically accumulated over a much longer period. My colleague Michael Ashale is currently with NARCOC at a secured location where preparations are underway for the destruction exercise, and joins me. Michael, so just how large is this latest seizure?
Well, NARCOC at the moment is very tight-lipped about the exact details of all of this, but what we managed to glean from them is that today's haul is worth between a street value of about 12.8 million Ghana cedis to 13 million Ghana cedis. So that's exactly what we have here. But we also know that this includes cannabis, cocaine, and as well tramadol. They will not tell us the exact details, but just a few minutes ago, 2 trucks full of tramadol just arrived here to join the stash that will be burnt today. And they are told that this was part of the stash that they managed to seize at the port, Tema Port specifically, in a 40-footer container, containing about 5,000 capsules of tramadol. A big catch there, and I must say that the last time we were actually here was just on 20th of June, and it didn't have this much tramadol at that time.
Well, Mike, what have you been picking up? Are these drug disposal operations becoming more frequent than ever before?
So the last time we were here was 20th of June. It's exactly 2 months and 2 days, and now we are back here. Prior to the month of June, they were here in November 2024. That definitely means that it took them the first time in this year about 6 months to come here, and now it's taking them 2 months to be back at the site to incinerate. That definitely means that they are getting more and they're incinerating more in the shorter period of time since they started this renewed crackdown. In fact, on 20th of June, what the Director General of NACOC at the time told us was that they were going to renew and escalate their crackdown on illicit drugs. And clearly what we are seeing is that in just 2 months, they managed to get well over 12 million worth of illicit drugs that they are here to incinerate today.
Well, thank you, Michael, for that update from NACOC. Now, moving on, the Public Accounts Committee of Parliament has questioned the substantive increase in rent payment by the Youth Employment Agency is over a 72% between 2023 and 2024. The Auditor General's report noted that in 2024 alone, the YEA paid 5.5 million Ghana cedis as compared to 3.2 million Ghana cedis in 2023. Now, management of YEA attributed the increase to the decision of the Ministry of Works and Housing to give the building to a private entity to manage. This is what transpired.
I think my chairman asked you a question and you said you don't know Mrs. K&A. So you don't know them?
No, Mr. Chair, we know them, but we didn't engage them, Mr. Chair.
But you said you don't know them?
No, we know K&A as a facility manager, but we didn't engage K&A.
So there was no agreement?
Mr. Chair, there is an agreement. But the agreement is between K&A and Works and Housing. Yes.
In that case, Works and Housing gets here. They'll have to explain even further about this one. Because whom were you paying the money to? Was it to Works and Housing or K&A?
Mr. Chair, we paid the money to K&A, the facility manager.
Okay.
Auditors, let's take here. One is a service charge, and the other is a rent. The rent should be going to the ministry. If you could provide this committee some traces that indicate that K&A paid this rent money to the ministry, I think it will be of help to this committee so that we know that nobody...
They can fetch a copy of the tenancy agreement or whatever MOU they have so that we can understand fully what the transaction arrangement is. Then we can later discharge them or otherwise.
Thank you.
My colleague James Avaji is still at the Public Accounts Committee and is bringing us updates. Now, James, there have also been a number of other infractions, including unearned salaries. How were those resolved?
Well, MFR, those are salaries paid to over 26 former employees of the Youth Employment Agency, and amounting to over 160,000 Ghana cedis. Well, the explanation from the managers is that they are trying to get them to pay the monies. In fact, for some of them, they said they have reached an agreement to get those monies from them. Some are even deceased, and so those ones had to be ruled out. But the committee has given the managers of the YA and the employment, the Youth Development Ministry, some 30 days to get those monies back. But one of the biggest issues that came up was the non-payment of pension remittances for employees on salary arrest. So they work for the agency, Their salaries are not paid in time. And when government decides to pay the money, government is unable to pay their tier 2 and tier 3, tier 1 and tier 2 pension remittances amounting to over 1.6 million Ghana cedis. The promise from the new management is that those are some of the liabilities they have come to inherit. And so they will liaise with the finance ministry to see how those monies can be paid. And members of the committee were not happy for people to work for government and their pensions will not be paid in time. And so those are the key issues that has been coming up with the Youth Development Ministry and the YEA.
On the unearned salaries, were there names that were mentioned?
Of course, all the names of the persons involved have been published in the Auditor General's report, about 26 of them in total. And so Chairman went on to mention a few of them, and some of them, even when they were writing for the money, for instance, there is one, Felix Owusu Jima, who was mentioned, and one other person who wrote to the agency demanding their money, but quoted a higher figure compared to what was really due them. And so those are some of them, but the full list, 26, have been published in the report, MFR.
Right, and a little later, which other sector would be facing the committee?
So the Works and Housing Ministry has just left. They had only one infraction, so they spent less than 5 minutes. Currently is the Ministry of Education, led by the Deputy Minister, Clement Park, who are attending upon the committee. A lot of the infractions have been payment without validation across some parts of the country, and those are the questions they are answering. For those that the district managers could not answer to, the committee rules that they pay the monies from their own pocket in 30 days or in 60 days. So we see how it all pans out with the Education Ministry, MFR.
Thank you so much, James Aveji. James Aveji is at the Public Accounts Committee and bringing us update over there. Now, moving on, Ghana Gas says it is on track to complete its ongoing maintenance works within schedule, assuring that more gas will be made available for power generation. According to the company, this is crucial to support the government's 24-hour economy policy and prevent any potential return of doomsday due to the temporary shutdown. Chief Executive Officer Judith Ajuba Blade disclosed this at a training workshop for journalists in Takoradi.
Since 16th of August, we have shut down the gas processing plant for major maintenance. Some of the maintenance works we are doing are works we haven't done ever since the plant was built. So, and it's not because we are not doing that, it's because the owners of the manufacturers of the equipment put down, the instructions that you can only open this in 10 years, you can only do this in 5 years. So this year's maintenance is very major because it offers us opportunity to do some of the things we haven't done for 10 years. And we are still committed, totally committed to giving the plant back to the Minister of Energy in 10 days. We started on the 16th. I'm praying that by the 10th day, which is about the 26th or the 27th, we'll hand it to the Ministry of Energy. At that point, the plant will have better integrity because we've maintained it. So the purpose of this shutdown maintenance is to put the plant in an enhanced way such that we can even take some more gas. So the minister is on us to take more gas. So it's only when we've maintained it and maintained it very well.
Now, Ghana is set to receive $100 million investments to expand farmer financing. The announcement made by Japanese agri-tech company Degas Limited during the Ghana Presidential Investments Forum in Accra is aimed at building Africa's first AI-powered agriculture hub. Speaking at the forum, Degas CEO Doga Magikura indicated that the investment will transform smallholder farming and expand Ghana's role as a continental leader in AI-driven agriculture. There's more in the following report.
The 4-year commitment will scale up AI-driven satellite monitoring, precision agriculture, and farmer financing. Agriculture employs about 40% of Ghana's workforce, with nearly 70% of these being smallholder farmers who work on plots averaging just 2 to 5 hectares. Many of these farmers face low yields and limited access to financing. CEO and founder of Degas, Doga Makura, speaking at the forum, indicated Ghana is proving how these technologies can boost productivity and reduce risk for farmers. President Mahama, who is currently in Tokyo for the Tokyo International Conference on African Development, welcomed the investment, calling it a vote of confidence in Ghana's agricultural transformation agenda. The AI-Powered Agriculture Hub model is projected to expand farmer financing, strengthen satellite-enabled crop monitoring, and deepen partnerships across input supply, logistics, and processing to build resilient value chains.
The National Coordinator of the Ghana School Feeding Program, Hajia Fati Fogo, says the government has increased the feeding grants from 1 Ghana cedi, 50 pesos, to 2 cedis per pupil as part of its reset agenda. The increment, she explained, is to improve the quality of meals served in beneficiary schools. She cautioned that caterers who fail to cook for pupils for up to 10 school days will have their contracts revoked and reassigned to others ready to deliver. Hajia Fati made this known at the training session for caterers in the Upper West region. Upper West regional correspondent Rafiq Salam reports.
The Ghana School Feeding Program, implemented by the government of Ghana and other international development partners, provides food to children of school-going age. The program seeks to contribute to an increase in school enrollment, reduce short-term hunger and malnutrition of kindergarten and primary school pupils. In addition, it is to boost domestic food production. The program over the years has been bedeviled with several challenges, including lack of transparency and accountability, inadequate finances apportioned for feeding per child, delay in payment of caterers, and the quality of the food prepared for the children. Over 3.5 million children are benefiting from the program nationwide. Speaking at a training workshop for newly contracted caterers of the school feeding program in the Upper West region, National Coordinator for the Ghana School Feeding Program, Hajia Fati Fogo, asserted that the program is on a reset, adding that it will be a complete departure from the past where certain behaviors and conduct of the caterers were overlooked. She warned caterers who fail to cook for the children to equally stay away from payments.
If there's anybody in here who thinks that it's just a matter of getting the contract, but then you can do whatever you like with the program, then sorry, you have gotten the wrong opportunity, because we will not tolerate that. Please, if you know you did not provide the service, do not expect any payment. If you are a caterer here and you are not able to provide the service for 10 school-going days, we have the authority to be able to withdraw your service as a caterer and give it to someone who is prepared to offer that.
Hajia Fati Fogo disclosed that government, as part of the reset agenda to improve the quality of service, particularly the quality of the food provided at the schools, has increased the amount allotted for each child from 1.50 Ghana cedis to 2 Ghana cedis.
Just a week or two ago, you heard that we had paid caterers who provided the service for second term during the previous administration. Their time, it used to be 1 cedi, 50 pesos per pupil. Today, they have also benefited from the research of school feeding program in Ghana by taking 2 cedis per pupil. As I speak to you, those of you who actually provided the service, data is being collated for us to see how quickly and fast we can pay caterers as quickly as possible.
The Ghana School Feeding Program Coordinator also has this appeal for those fighting caterers assigned to their respective communities and districts.
Those of us who are fighting our colleagues, our own, who have been assigned to their districts, I want to plead with you. I'm begging you, let's stop giving that wrong signal to the general public. The program is not being funded by GOG alone. We have partners who always come out to support the school feeding program. But since we assume office, we are unable to get that because of the way we are portraying the whole situation on the ground. It is not.
Now, turning school grounds into bread baskets, that's the goal of the Feed Ghana program now being implemented in schools across the Bono East region. My colleague Anna Sabit was at Nkranza together with the Deputy Minister for Agriculture, where senior high schools are farming dozens of acres to feed their students and raise money. But they are calling for more government support to overcome a major hurdle, a lack of tractors. There's more in this report.
From the heart of Ghana's food basket, a new generation of farmers is tilling the soil. But these aren't your typical farmers. They are students and their classrooms extend far beyond four walls. This is the face of government's ambitious Feed Ghana program, an initiative taking root in the most unexpected of places, our secondary schools. The goal is monumental: boost agriculture, create jobs, feed the nation, and supply raw materials for a new era of agro-processing. And as our Deputy Minister of Agriculture discovered today, schools like the Nkranza Technical Institute and the Nkranza Tech are leading by example. Andrew Sohini-Boatin is the principal of the NTI.
Yes, this is a school farm that we have cultivated 28 acres of maize, and we have few mangoes and cashew also in there. We also have livestock, and it's helping us. So for the past 4 years, we are making a lot of money and also feeding the children as well.
But the path to a bumper harvest isn't without its thorns. The enthusiasm is palpable, but the tools are basic.
Unfortunately for us, though we have a great department which is championing this particular project, we don't have tractors to help them.
And the story is the same just few kilometers away at the Nkranza Secondary Technical School. Here, they've taken on an even more ambitious project, over 30 acres of maize and vegetables. This contributes immensely to the food used in feeding the students here.
We don't intend taking it anywhere. It is for the students. Anytime our maize supply is not in, we rely on it. We will have enough to feed our students. The vegetables, we have started supplying a bit of it to our kitchen.
Hearing these appeals directly was the Deputy Minister for Agriculture in charge of the Feed Ghana program and Member of Parliament for Ayawaso West Wuogon, John Dumelo. His visit to the Bono East region was to see the progress firsthand.
As we all rightly know, the President launched the Feed Ghana project in this region, and as part of our responsibility as a ministry, we need to ensure that schools and churches and everybody is linked to the Feed Ghana project. And so today I'm here on a working visit to be able to take a tour and see the number of schools that are engaged in the Feed Ghana program and see how best we can help them.
He spoke about government's plans to improve irrigation to enable year-round farming, as well as supporting these schools with even enough resources through the farm services centers to help improve production.
The headmaster mentioned something about tractors and so on and so forth. That is why we've come up with the farm service centers, where is a one-stop shop where when you enter you have tractors, you have combined harvesters, you have planters, and so on and so forth. And so once that one also comes in place, I don't think schools will have such a problem.
Bono East Regional Minister Francis Oso-Antwi, who led the team to the farms, believes the program's impact will extend far beyond the school gates.
If you are able to produce more, it means that your people will be self-sufficient. You won't be at the end depending on other countries to survive.
From these school farms, a larger vision is growing. A vision of a Ghana that feeds itself, exports its produce, and creates wealth from the soil up. The seeds have been sown. Now with the right support, the entire nation awaits the harvest. Anna Sabit, Joy News, Nkranza.
You're watching News Today. Please stay with us for business.
Welcome back to business here on JoyNews Today. My name is Winston Taki, and our first business story. Secretary General of the ClimateVulnerable Forum and former President of the Maldives, His Excellency Mohamed Nasheed, has called for urgent global action to ease the debt burden crippling climate-vulnerable nations. Here's more in this report.
At a media engagement of the ClimateVulnerable Forum, Secretary General and former President of the Maldives, His Excellency Mohamed Nasheed, called for an urgent global action to ease the $746 billion debt burden facing climate-vulnerable nations. He warned that without systemic debt solutions, these countries will not be able to invest in resilience and development.
In our debt repayment, we have to, between this year and in the next 5 years, pay out $746 billion to creditor countries. So we are paying out more than we are getting funds into our own countries. So that is the situation that we are in. Now, we are suggesting to IMF, the World Bank, and the international financial institutions that if they extend debt payment periods from the current 20 odd years to 40 years, we would be gaining $267 billion. If the international financial institutions would reduce interest rates lower to 1.3%, again we would find another $454 billion. It is a 37% reduction. So in the international advocacy space, we are working on these two main things: reduction of the payback period, or increase of the payback period, and reduction of the interest rates.
He also explained that by turning carbon exchange matters into more tradable elements, member countries can raise additional financing.
We have the trees, and everyone knows if these trees are not there, the planet will not survive. So for us to look after the trees, there has to be finance coming into it. This is what we call the carbon trade. Now, Ghana has a tree, and to look after that tree, someone who is emitting poisonous gases to the atmosphere must pay for the tree, because the tree is sequestering. It's capturing the poisonous gases, and it's a filter that filters the atmosphere. So someone has to pay for Ghana tree. Now, what we think we should take to COP30 in Belém, Brazil, is a better arrangement on carbon finance. And I think that would unlock a lot of capital that comes into our countries.
The ClimateVulnerable Forum has grown from 11 countries in 2009 to 74 member states today. It is calling for measures such as extending repayment terms to 40 years, lowering interest rates, climate debt swaps, and automatic debt standstills to reduce fiscal pressure.
Now, away from that, the Minister for Labour, Jobs and Employment, Dr. Abdul Rashid Hassan Pelpo, has cautioned that while working from home is not inherently a bad idea, Ghana is not yet prepared to fully embrace it. He stressed that the country must first strengthen its technological infrastructure to effectively support remote work. His remarks comes in response to recent calls for adopting a work-from-home policy on Mondays and Fridays.
If we have developed our technology to the point that people can work from wherever they are, it is possible to work from home, to be given assignment from home, and to be able to present their work schedules whilst home. But there are some skills that some work that must be done at the place of work. So it can be of larger scale than we are imagining. It could be some specific areas of inputs. But it's important that we are present at work at any point in time. But if we get to the point when it is true that by the kind of culture we have, attending funerals, going to marriages, doing social events will take off the energy and time of workers at work. Some can be allowed to do so, you know, not cutting off any bit of what they have to do within the 8 hours, but to make sure they still deliver from home. But essentially, in Ghana, we've not gotten to the point when we can work from home. And it may be something, it can be something we can put in mind and thinking about.
We have business for you on the marketplace at 1 p.m. Up next is sports.
Good afternoon, everyone. Welcome to Sports here on JoyNews Today with me, Muftaro Nabila Abla. We're just a few hours to the Joy Sports Invitational Tournament. And Medical Commission, they say that they are eager to win as many medals as possible in this year's event. Last year, during their participation, they walked away without a single medal. But this time around, they are hopeful that the experience gained from last year will come in handy.
I saw Jesus standing at the corner. Jesus standing at the corner, singing hallelujah, amen.
You haven't seen nothing yet. Yes. You know, last year we told you guys that we were coming to cause, you know, havoc in the event. We signed up very late, just like this year, and we said that watch out for Minkom. And you know, in soccer, we won 2 of our matches back to back within regulation time, no penalties. And even the third one, we knew that we were robbed. But you know, we give it out. Yeah, I mean, we give it out. We won medal in arm wrestling. We won medal in sack race. And we are coming this time, you know, with a full vim, knowing that we are bagging every full vim.
The full package will be coming your way at 8:30 p.m. during Joy News Prime. MFI is standing by with the rest of the news.
Well, thank you so much, Muftau. That will be a wrap. But a gentle reminder that tomorrow on Newsfile, you do not want to miss it. That we have a lot of topics to discuss. Cocoa price debate. Is Ghana's the highest and the most competitive in the sub-region? City stability as well, and G-Tech crackdown. You don't want to miss that conversation on Newsfile. Thank you for watching the news today. There's more if you log on to myjoyonline.com. I'm MFA Akusia Adeti.